Murray asked me actually to talk a little bit from a community provider perspective. Some of the kids that we treat go into SIPP programs, come out of SIPP programs. And just to give you a little background, I am, of course, a child psychiatrist. I have been at the Henderson Behavioral Health. It's a pretty large community mental health system in Broward County. We serve about 20,000 patients a year, anywhere from 17 to 20,000 every year. And a third of our patient population is children, 18 and under. So we really have a big patient base. But aside, I've been there for 20 years. I've also been the medical director there almost 11 years. So not only do I have direct clinical experience, I see kids at Henderson Behavioral Health, I also am involved, obviously, being the administrator. We have about 16 psychiatrists. So I oversee the medical department. And so it's a pretty responsible and stressful job. The other thing that I have done, which I started doing even before I became medical director, was consult for Camelot Community Care. Camelot is a therapeutic foster care program that has several branches all over Florida and also in other states. I know Clearwater, we probably have a Camelot therapeutic foster care system. And I have continued to work there because I had been working there and I love working there. And at Camelot, primarily the population is the dependent children. So I really am very involved with the children who are in foster care. And of course, we get kids that step down from SIPPs and they come into the therapeutic foster care programs. We have a branch of Camelot both in Broward. We have a branch in Palm Beach also, and I consult for both of the therapeutic foster care programs. And Kids in Distress, I'm their consultant psychiatrist, and a couple other group homes also in Broward County. So I'm kind of all over the place, and like I said earlier, as part of Henderson Behavioral Health, we provide the mental health services for the Broward Detention Center, and I'm their consultant psychiatrist. So, you know, I really have a wide range.
What do you do in your spare time?
Right, yeah, I'm here. So. We probably have, you know, you probably went over this on Friday, came a little late. There are 6 circuits in Florida serving 67 counties. It's 15 SIPPs. Services are provided in an intensive residential setting, and it's a Medicaid waiver program. These are the different circuits, and I guess the one that I am involved with is the Southeast, AFC's Florida Palms Academy, the CATS program. And many of our children also go to Sandy Pines, and some of them also step down from Sandy Pines to the therapeutic foster care programs. So what is the criteria for admission? Who goes into a SIPP? A child or adolescent has a serious emotional disturbance with a primary diagnosis of a psychiatric disorder, not a primary developmental conduct or substance use disorder. There's serious functional impairment. Acute inpatient and intensive outpatient services have failed to bring about sufficient resolution of child symptoms, and community setting cannot provide interventions or support needed by the child. And here's where Henderson Behavioral Health comes into play, because we do have a lot of intensive outpatient services, including a program which is kind of parallel to the adult FACT teams or the ACT teams. We have alternative to residential treatment program, just a group of 40 kids, intensive wraparound. So if something like that fails, then of course we have to consider residential programs. And what is a goal? What are we expecting to happen when a child goes into a SIPP? The expectation, of course, is that the child stabilizes. There's stabilization and adequate resolution of symptoms. It allows the child's safe return to the community within 4 to 6 months. That's the expected length of stay in a SIPP, is anywhere from 4 to 6 months. And there's reduction of psychiatric readmissions through quality treatment and extensive aftercare planning. So a child who has had repeated hospitalization goes into a SIPP, comes back out. Of course, the expectation is once they're out, after intensive residential treatment, they're not going to have that frequency of rehospitalization like they did before they went into a SIPP. Now in Broward County, we have something called the SIPP, which is the Family Services Planning Team. And basically what a SIPP does, I don't know how it's done in the other counties, but this is how we do it in Broward County. The SIPP is a freestanding, independent, multidisciplinary team of individuals from various social services and mental health organizations, as well as voluntary community parents. There'll be parent advocates, there'll be a representative from various community providers, including Henderson Behavioral Health, you know, Camelot, there could be somebody from the DJJ system, ChildNet, which is the child advocacy, you know, the state DCF, child welfare. So they meet, actually, the venue for meeting is at Henderson. They meet there, and they meet once a week, and the purpose is for community planning. The families also come to the meeting, the parents would come, and they are provided input from various sources, and they make clinical recommendations. So it's kind of to look at, is there any other option? Is there any other resource that could be utilized to help this family, for the child to utilize? Is there anything else that we haven't really provided for this family? The SIPP also reviews requests for residential services and makes recommendations based on the written and verbal information presented. Parents and funders are free to accept or decline SIPP's recommendations. It's really not any particular agency. It's just more like a planning, providing recommendations, giving feedback to the family. That's the purpose of SIPP. And they also review requests for residential services. So the SIPP says, no, we disagree with residential, then it might be a little difficult to get that child into residential placement. So how does someone prepare for the SIPP? Who does that? The people presenting at SIPP should be prepared to provide a clear picture. So they really need to prepare to go into the meeting. They cannot just go and not have chronological information, documents, psychological assessments, psychiatric evaluations. They need to have current information on the child, school functioning information, past services, list of medications, et cetera. And usually this information is compiled by the case manager. And the thing about Henderson Behavioral Health is Henderson is contracted to provide case management for all children in Broward County, regardless of where else they're getting other services. It could be a private psychiatrist, or it could be other providers that is providing the child with therapy or psychiatric services, but the case management piece is provided by Henderson Behavioral Health. We have multiple case managers, 50, 60 case managers, and they are actually coordinating the SIPP, and they are assembling all this documentation that is required to support the need for residential placement. And SIPP will recommend the residential treatment based on the clinical recommendation and information presented. So the clinical recommendation piece becomes very important when a child is being presented at SIPP. The children who are staffed at SIPP could either be dependent kids or community kids. So we have the two sets of kids, and there might be a little bit of a difference between the dependent kids. The dependent children generally have a suitability assessment, and the suitability assessment is done by private evaluators who are paid by Child Welfare Agency, and the court can do a review and actually order residential treatment. So sometimes they may just kind of bypass SIPP also. The court orders it, the suitability assessment is done. But for the community kids, they really need to go through SIPP. They go through the recommendations by the psychiatrist. In 2009, of the kids in SIPP, 26 were dependent and 68 were community kids. Is that correct?
Yep.
Okay. So what is the role of the community psychiatrist? As a community provider, I would need to provide up-to-date psychiatric information in preparation for SIPP. Diagnosis, medication information, and of course the recommendation for residential placement. Appropriate documentation such as a current psychiatric evaluation, and many times an adequate clinical summary and reasoning for the recommendation for residential placement. coming from the psychiatrist, especially for Medicaid funding, it is really important that the psychiatrist compiles a very good letter of recommendation that kind of lists why you're coming to that conclusion. Why is it that you think a child needs to go into residential placement? And sometimes the quality of that letter is extremely important for residential placement to happen. Sometimes the quality of letters provided are not that great, and it becomes an issue. So what are the challenges in terms of getting a child placed in a SIPP setting? What are the challenges for the community psychiatrist? Again, we have heard about time again today. Enough time, lack of time. Need enough time to prepare for FSBIT with that letter, that current psychiatric diagnosis, the current, even a psychiatric assessment report. And sometimes what happens is we're not given the opportunity to coordinate or consult with other treatment professionals. There may be a therapist from a different agency who's providing in-home services that you probably have never met. That there is someone coming to the house for the past 3 months, you don't know who they are. So you may not have that opportunity to coordinate the therapy. I have a better, I have the advantage that the case manager is at least co-located right there. But there may be a community psychiatrist that is not a Henderson psychiatrist and may not have that advantage to coordinate with the case manager and the therapist. Sometimes we don't have comprehensive or current information. For example, I may not have seen the child for 3 months, not because I don't want to, but because the child may have been on runaway, or the child is constantly getting hospitalized and they just miss appointments. And then when it comes to writing that letter, you don't have adequate or recent information. You don't have a sequence of information. And despite efforts, this is the challenge from the SIPP perspective. I think a bigger challenge for me also is to not recommend residential. As a community provider, parents are pressurizing you to have the child placed in a residential setting. And I find that to be a bigger challenge to basically put your foot down and say, no, this is not something that is in the best interest of the child. And parents don't want to hear that because they're not making changes. The child may be doing pretty well in school because they are getting the behavior modification. They are they're not being barked at. They are responding pretty well to school interventions, but then they come home and they have severe tantrums and the family is not making any changes. I find that more of a challenge. Sometimes the other challenge is the child may be in a hospital setting, and the hospital psychiatrist may write just 2 lines saying residential placement, and that is not adequate, and then the case manager comes to the community psychiatrist, can you please write a letter? And then you are trying to do the right thing to help the child because you know that this is what's in the best interest of the child, and gathering that data and putting that in a letter takes time. So those are the challenges that the community psychiatrist faces when a child has to go to SIPP.